to tell you, I've looked over your hip health history and I have an idea of where you're at today with some radial neuropathy going on. So I can understand that you've been in a bit of a flexed elbow, flexed wrist position and having trouble moving out of that. Okay. So we're gonna see where you're at with the sensibility, and I'm gonna just touch and get comfortable with your arm, and you make sure you tell me if you feel anything that's aggravating you. Okay. All right. So while we're doing that, just because these shoulders have been probably having to do a lot more compensation, and there's stressed, environment happening, I'm gonna put some heat on your shoulders. Okay. It's quite neutral. It's not hot. It's just warm, and I'm gonna check on that a bit to make sure your skin's not. Okay. Alright, so I see your incision is about mid-range here, okay? So I'm going to move down the path of the nerve, and you're just going to tell me if you're feeling anything. Okay, you're still feeling that? Alright, moving down. Still feeling it? Okay, still there? Okay. Okay, so what I'm going to do is I'm going to warm up the tissue above your scar, and then we're going to work down into the unaffected side on the medial side of your arm on the inside. Then we'll work gently in through the denervated tissues where you're having more of your issues on the lateral side of your arm. I'm going to get you in a comfortable position because there's probably been a bit of swelling, so we'll get that elbow above your heart, get your wrist above your elbow, and you make sure you tell me at any point if there's numbness, tingling, pain. Okay, this is about you feeling comfortable and getting some healing. All right, so you want to be making sure you're trying to keep this wrist in this type of position, and we're working towards opening that hand and wrist up. So that's something to keep in mind when you're on your own as well. We will walk through some remedial exercises at the end of the treatment, okay? So some self-care, some homework for you to do. All right? So I'm just going to have some contact with your skin. Just work through some really superficial warm up of this tissue. The goal is to just keep some fluid moving and get the tissue warmed up without aggravating the path of the nerve, okay? So I would just do superficial like this for 2 to 3 minutes. Start working down through the medial side of your arm. Up, forward. Could gradually work into a little bit of kneading, fingertip kneading. See if there's any trigger points, any jump sign or anything that stands out. And after you've done 2 or 3 of those superficial neuromuscular techniques, feel like the tissue's warm, we can move into the denervated tissue. Checking in with the client, how's the heat? It's all right, looks fine. And how's this on this side? Okay. Okay, so I'm going to do a little bit of stimulating technique. This is a way that's shown to kind of just get that nerve back thinking about doing what it's supposed to do. So I need you to also think about that hand coming back into that extended wrist position. So as I'm tapping through the nerve pathway, I want you to try to move that wrist. Yeah, exactly. So keeping that wrist. So the mind is a powerful thing. I want you to be thinking into the movements that you're doing. So even though that tendency is going to be there, maybe to bring that wrist into flexion, think through just like your other hand at the same time to be moving into that extended wrist position. Okay? Good. Okay. So anything that we do after the treatment that's been aggravated, I want you to do some hydrotherapy on that if you need heat or ice, and make sure you're aware of how that's feeling because that tissue is sensitive. Probably keep it on the shoulder and upper arm for now. You can start as sensation and functions coming back. You could try some on the lower as well. And we'll walk you through some remedial exercises and care for home. Okay?